Welcome back to Race in Rhode Island, the path forward.
Yeah, we're here to talk about health disparities. Let's introduce you to our panel. Right over here, we have Dr. Nicole Alexander Scott with the Department of Health. Thank you for joining us. And Secretary Womanzetta Jones with the Health and Human Services.
We have Central Falls Mayor James Diosa, and we have Dr. Ernestine Jennings, psychologist with Lifespan. Thank you all for joining us.
Yeah, and I'd like to start with you, Dr. Alexander Scott. We talk, well, for years, I think I've been talking about it, but more recently, racism as a public health crisis. I think many of us have known this all along, but now it's in the spotlight.
It is, and it's something that's so important for us to call out as a public health crisis. We've had a focus on addressing determinants of health, living conditions that people are in, housing, education, access to fresh fruits and vegetables, jobs and employment. What we want to do now is really call out the fact that structural root causes like racism contribute to why there are differences.
Mayor Diosa, I know this COVID pandemic has really highlighted the challenges your community is facing right now. How are you trying to overcome that, and what resources and what do you need to be able to achieve that?
One of the issues we experienced is while many people were able to work from home, our folks were still working in the restaurants, they're working in the warehouses, service jobs, janitorial jobs. So the spread continued to grow and grow. And people in Central Falls don't have the luxury to, find a bedroom where they can isolate or quarantine. And so the spread would happen within their family and then more relatives, and it continued growing. And that's why per capita we are higher than the state of Rhode Island and even places like the Bronx.
All right, we want to continue our conversation now on health and wellness, and our guest joining us now, new to the panel, is Nico Merritt with the Newport Health Equity Zone. Thank you so much for joining us.
Thank you for having me.
The Newport was one of our champions in action from about 4 years ago for inclusiveness and trying to fight racial disparities in terms of people's access to health care and wellness and information. Tell us how you've been doing since then in the various areas that you are trying to address.
We are always building momentum and starting new programs. So we also focus on Black maternal child health care. And we also focus on the LGBTQ plus mental health. So we have programs. So each component of our community and those who are not getting the attention they need, we develop a program and we show them support in whatever they need.
Dr. Alexander Scott, when you were at that champions announcement, and what you said, a quote you said stood out in my mind, a person's health should not be determined by his or her zip code. Are we working to try to erase that barrier?
When the community is able to inform, this is what we are experiencing, this is what we know needs to be changed. The health equity zones is designed to be an infrastructure that allows for resources to support and uplift the changes that are needed. We want to sustain that. That's how you're going to have improvement over time, how we can chip away at the systems that have been mentioned, and how we can reverse some of those outcomes that we know can be reversed.
Secretary Jones, how can you, from your office, address the inherent biases that we're talking about in the healthcare system and the people that are served under it?
From my office, we can work with each of our departments to ensure that they are creating not only race equity committees within their departments, but that those committees are influencing the policies and the procedures and the protocols. Our secretariat is 40% of the state budget. So we have a far reach and we can do a lot. But what we need to also remember as we look at the historic systemic racism, when we're trying to hire people who are a reflection of the communities that we serve, we need to ensure that we build supports. So we are hiring, we're supporting, which allows for promotion and advancement, and not just, oh, we hire, but our turnover rate is so high.
And I want to talk about the emotional impacts of what's going on. We have a few pandemics going on in the Black community, the Latinx community, beyond the coronavirus. You know, we have gun violence, we have health disparities, everything.
Yeah.
How do we all deal with the emotions that are all bottled up and we don't know where to go with them?
Understanding when you are not well. So for some of us, we go and we crash. that's not well. And when I talk with people, they'll say, well, I just have the blues. That's not well. You want to make sure you understand it's okay to not feel great, and know the resources that you can reach out to. So with all this going on, a lot of people felt overwhelmed. They're not sleeping. Some people don't understand why. And I ask them, is this typical for you? No, it's not. That's not well. So what is typical for you? How can we get you back to your baseline? And being okay with that, being okay to reach out for help, and help being available is important. But knowing what's not well for you and that it's okay to experience those things is what we need.
How can we use our emotions to maybe funnel them into hope and not disparity? I mean, what can we do?
Being accountable and seeing what progress you are making. So taking the time, not getting so burdened down with what's not going well, but look at what's going well and use that energy. Anger is a sign. I need to get something done. Sadness is a sign. Something's not sitting well with me and I want to work towards changing that.